Welcome to another episode of Med Madness. Today we delve into a crucial topic for medical students and healthcare professionals: absolute contraindications to pregnancy. Understanding these conditions is vital not only for patient safety but also for guiding clinical decisions and counselling. In this episode, we will explore various conditions that make pregnancy highly risky, the associated pathophysiology, symptoms, diagnostic methods, and management strategies. We'll also look at a real-world case study to illustrate these points. Next, let's discuss what these conditions are. Absolute contraindications to pregnancy are medical conditions that pose a significant risk to the mother's life if she becomes pregnant. These include pulmonary arterial hypertension, peripartum cardiomyopathy with residual left ventricular dysfunction, heart failure with a left ventricular ejection fraction of less than 30%, severe coarctation of the aorta, severe mitral stenosis, severe symptomatic aortic stenosis, and severe aortic dilation, such as in Marfan syndrome. Each of these conditions can severely compromise cardiovascular function, making the increased physiological demands of pregnancy potentially fatal. Now let's talk about symptoms and clinical presentation. Patients with these conditions may present with a range of symptoms depending on the specific pathology. For instance, pulmonary arterial hypertension can cause shortness of breath, fatigue, and chest pain. Peripartum cardiomyopathy might present with symptoms of heart failure such as dyspnea, orthopnea, and peripheral edema. Severe mitral or aortic stenosis can lead to syncope, angina, and heart failure symptoms. These clinical presentations highlight the severe stress these conditions place on the cardiovascular system, particularly during pregnancy, when the heart's workload increases significantly. Moving on to diagnosis. Diagnosing these conditions involves a combination of clinical evaluation and diagnostic testing. Echocardiography is a crucial tool, providing detailed information on cardiac structure and function, such as left ventricular ejection fraction and valve gradients. Cardiac MRI and CT angiography may be used to assess aortic dilation and coarctation. Right heart catheterization is essential for diagnosing pulmonary arterial hypertension. Additionally, a thorough history and physical examination are vital to identifying symptoms and risk factors that may contraindicate pregnancy. Next, let's cover management and treatment. Managing patients with absolute contraindications to pregnancy focuses on minimizing risk and optimizing health. Preconception counseling is critical, where healthcare providers recommend against pregnancy and discuss alternatives. If a patient becomes pregnant, a multidisciplinary approach is essential. For those with peripartum cardiomyopathy and residual left ventricular dysfunction, medical management includes beta blockers, ACE inhibitors, and diuretics, although some medications may need to be adjusted due to pregnancy. In severe cases, heart transplantation may be considered. Regular follow-up with cardiology, close monitoring, and potentially early delivery are strategies to mitigate risks. Lifestyle modifications, such as avoiding strenuous activities and maintaining a low-sodium diet, are also important. Now let's consider a case study to illustrate these points. A 32-year-old woman with a history of peripartum cardiomyopathy and a left ventricular ejection fraction of 25% presents for preconception counseling. Despite significant symptom improvement with medical therapy, her cardiologist strongly advises against pregnancy due to the high risk of maternal mortality. The patient understands the risks, but desires pregnancy. After thorough counseling, she decides to proceed. Her care team closely monitors her throughout pregnancy, adjusting medications as needed. Despite these measures, she develops worsening heart failure in the third trimester, leading to an early delivery and extended postpartum care. In summary, absolute contraindications to pregnancy are critical conditions that require careful management and counseling. Early diagnosis and intervention can significantly impact maternal and fetal outcomes. Medical students and healthcare providers must understand these conditions' complexities to provide optimal care and guidance. Engage with our pre- and post-podcast quizzes and Anki flashcards to reinforce your learning and ensure you're well prepared for clinical practice. Thank you for joining us on this episode of Med Madness. Stay tuned for more insightful discussions on essential medical topics.